Thank you, Lorraine, for asking me to come and do a talk today. I'm happy to do it. My story goes back to August 2018. We went to Rome on holiday, and then when we returned, I just wasn't feeling right. I knew something was wrong. I didn't know what it was. So I went to my GP, saw my GP. GP said, okay, let me send you and get some tests. Let's get some tests done. So I had some blood tests done. I had a sort of urine tested because I thought I might have been dehydrated. It was really hot in Rome, and I wasn't drinking enough water. I thought I might be just dehydrated a little bit, but all the tests came back fine. They said there's nothing wrong. There's nothing that we can see. Seems to suggest there's anything wrong. So then it's carried on like that until October, and in October, one morning I got up and I discovered there was a lump on the side of my jaw. So I went back to see my GP. The GP said, okay, let's get you to see a specialist. I went to see my specialist, and my specialist said, I think it's probably just a bacterial infection. Nothing to worry about, but what we'll do is we'll send you for a scan. So I went to have a scan done, and the radiologist who was actually doing the scan, he said, okay, I'll drain, there's some fluid there, so I'll drain that out for you. And nowadays, it's normal practice to scan the whole of your neck area. So it was whilst he was scanning my neck area that he noticed there was some suspicious nodules on my thyroid, and also one of my nearby lymph nodes had swollen up. Anyway, so he sent the report to my consultant. A few days later, my consultant called me in, and he said that they weren't happy with the scan and what they saw, and they would like me to go back and have a biopsy done. So I went back, and I knew there was something serious going on at that point because the way he sort of came across and what they had seen didn't seem that good news. So I went back, had the biopsy done. They sent they basically just drained some fluid from my lymph node, and they sent that to the lab. And then a few days later, my consultant called me to say they've had the results, and they said apparently it's papillary thyroid cancer. So you can imagine how I felt. It was just my whole world is like gone, and I didn't know how to react. I just thought, how can it be? It's not something that I would have cancer. It's just the words. But anyway, the consultant said he was going on holiday, but he said that what he'll do is he'll leave forms at the hospital, collect the forms you need to go for MRI scans and CT scans, and so I had all the scans and everything because I wanted to check to see if my cancer has spread. Luckily it hadn't spread, fortunately, and then I was told to see a consultant, a surgeon, to have the thyroid removed. So this is when I was put in contact with Leo Cheng. Leo Cheng is really well-known consultant, but I didn't know that at the time. I was just referred to him, and so I had my thyroid removed, a total thyroidectomy. And then after the thyroidectomy, I had radioactive iodine treatment. With radioactive iodine treatment, you have to go on a low iodine or no iodine diet. So before you actually have the treatment, so for a few days, I think I was basically having no salt, no dairy products, fish, everything that's got iodine in it. And then I had the radioactive iodine, which is really just a capsule. You swallow it, and then you'll have to be left in isolation. So I was in isolation for a day in the hospital, and then coming home, I was in isolation for 5 days. So because you're radioactive, so until your radioactive levels have actually gone down, you can't be close to people because they can be affected as well. So basically, I think I had a bedroom downstairs. We had a make-up bedroom, folding bed, with a bedroom downstairs, and I had the luckily I've got a downstairs like bathroom, and so that was just mine. And then so my wife was making the food, leaving it by the door, and I just had the going on the internet, watching Netflix, and it was just a period which was not great. So I had that done, and then there were lots of visits to my GP, and I was put in contact with an endocrinologist, Paul Jenkins. So get my thyroxine, because obviously I didn't have any thyroid, so I would have needed levothyroxine. So he started me on a 75 milligrams. So I started on that. But in the meantime, I was also seeing my GP, and in one of the sessions, my GP asked me if I would do a talk to the medical students that he has often coming into the surgery. And I said, yeah, I would be happy to do that. And then, I think it's medical students, it's knowing how to obtain a medical history, performing a comprehensive physical examination, which are the key skills. They need to learn what happens. They learn in various ways, which is like lectures, textbooks, and observation. But my GP said, what better way is there than a patient to go through their journey and for the students to learn that way? And I said, yeah, I'm quite happy to do that. And that's how I talked about my journey. There were about 6 students there on the day that I was called in. And they asked me various questions like, what were your symptoms? How long did you have the symptoms for? How were you diagnosed? That sort of thing. So I talked to them about, actually I didn't really have any symptoms.
Which hospital was you?
Well, I went private.
Oh, I see.
Yeah, my doctor did say that he was quite happy for me to refer me to Royal Marsden. So I could have gone there, and I was debating. I have got private cover, and then because they put me into contact with Leo Cheng, and then when I did all the research and everything, I was like, he sounds like a really good person to actually have. And the doctors, my GP said as well, he said, well, yes, he's well known. Strangely enough, when I was doing the talk to the medical students, they asked me who the consultant was, and they actually knew him. Apparently he does a lot of lectures, and I was reassured even more then by talking to them, because I thought, well, it's good that they know him, because he's obviously well known. So he must have, I probably chose the right surgeon, because how do you know whether which surgeons are good and which ones you just don't? So I think I was sort of reassured there. And and it's very strange, because I didn't really have any symptoms, thyroid cancer symptoms. I mean, my understanding is that for thyroid cancer, the symptoms are maybe your voice might change, a bit of hoarseness, or you might have difficulty swallowing, or you might have difficulty breathing, but I didn't have any of those symptoms at all. So really, when they discovered my thyroid cancer, it was coincidental, and it was all because I had a lump on the side of my jaw, which is something else that I'll go into a bit later. So it's strange how these things get discovered, because I had absolutely no symptoms whatsoever. But I think that GPs should routinely examine the neck area. So I think sometimes if they did that, they would probably be able to feel, if they can feel like a lump, it probably is like a swollen lymph node, then that is one way to actually, because that's another symptom. It's like if you have got like a swollen lymph node or something, and they can feel it, but they don't do that. And I think
GPs don't do that,
but they ought to.
At thyroid clinic, they do.
Yeah, I think they should be doing that routinely, but they don't seem to. But the feedback I got from the medical students is that they thought it was really good, because they learned something new that they were not aware of before, or it was reinforcing the knowledge they had already gained from lectures and textbooks. I think the outcome of it was really that there is no, every patient has different symptoms, and broadly speaking, yes, there are symptoms for thyroid cancer. I didn't actually have those symptoms, but the thing is, unless a patient goes through and talks about their own journey, which wouldn't actually be in the textbook, and it's completely different, and mine was completely different, doctors would not pick up on that, and the only way the doctors will pick up on that is if they actually listen to the journeys that patients have gone, because patients go through completely different journeys, and that's a way of actually building up their knowledge. So if a patient came in and they went through a similar journey to mine, they might think, oh, I listened to that patient, didn't I? And he had that. I wonder if it could be that. And that's one way of actually getting, you know, the diagnosis done as quickly as possible. So I really think that there is a lot of, you know, a real positive thing in patients talking about their stories. And it's a great education piece for medical students as well. The other thing I was going to talk about is several years ago, I had a few stomach problems, and I went to see my GP, and again there were some medical students there. They asked me, like, would you mind if one of the medical students examines you? And I said, at first I thought, do I really want a medical student to examine me? Because, you know, how do I know? How can I trust them? Anyway, so I said, yeah, if I don't, then how are they going to learn? They have to learn, you know, sometime. They've got to do something on a patient at some stage. So I let them do it, and it was fine. But the doctor also did it anyway, so I was reassured. And I think that patients should allow medical students to, you know, do these things. And a lot of patients are hesitant in doing this, and I don't think they should be. The other thing is, I was going to talk about is really, there are various procedures, not just to do with that patients often have to go through, which are not very nice. So things like an endoscopy or a colonoscopy. And I think that if patients who are a little bit anxious about going through those procedures, wouldn't it be a good idea for another patient who's gone through it to talk about it so they get reassured? That, I think, is a really something that needs to be done, and patients' voices are really, really important. And finally, I was going to say that there is a website, a social network website about patient voices on the intranet. So it's probably worth having a look at that. It's I was going to say, it's like basically I've got there's lots of stories on there. It's home to nearly 100,000 stories of health and illness, tragic losses, and miraculous recoveries. So I think that, I mean, for me, the way I've learned, and I know that we've all been saying how much the doctors tell us, and different doctors say different things, but for me, I learn more by what patients have actually gone through.